About 5 years ago, I ran into a colleague at a conference, and she thanked me for helping a patient who had Crohn's disease. And I said, "Well, how's he doing?" And she said, "Well, thanks to your suggestions, he got to about 80% cured, but he still had some underlying issues that couldn't be addressed, underlying symptoms." And so he went to an integrative physician and he got started on low dose naltrexone. And I was like, I don't think I'd ever heard of low dose naltrexone before. And she explained to me that it's used at a high dose to help people with opiate dependency, but it's used as a lower dose to reduce autoimmune disease activity, to reduce chronic infections, and it also seems to be effective for chronic pain. So today we'll present low dose naltrexone for pain, chronic infections, and autoimmune disease. If you enjoyed this video, please be sure to like and subscribe to our channel for more videos like this, and be sure to hit the alert button to be notified of new videos each week. So, what exactly is naltrexone and how does it work? Well, naltrexone is a pharmaceutical remedy. My understanding, it's been used since the 1980s in the treatment of drug addiction. And it was about 1985 where it was first discovered. The low dose naltrexone was first discovered, and it was discovered at Penn State University. Now, there was a doctor, Bernard Bahari in New York, who I believe he was treating AIDS patients, and also he had some patients who were having had chemical dependency issues. And what he noticed is that regular dose naltrexone seemed to reduce the activity of autoimmune disease, including AIDS, HIV. And so he started using the low dose naltrexone with his clients, and he found very useful results in areas like uh, autoimmune disease, multiple sclerosis, and that sort of thing. And so what he found is that the low dose of naltrexone found at bedtime reduced virus, supported the immune system, and also may have a role at reducing infections. Dr. Bahari also found that patients with cancer also could benefit from low dose naltrexone. As of a few years ago, there had been over 300,000 patients worldwide who've enjoyed the benefits of low dose naltrexone. Now, recently, I talked to a client I hadn't talked to in years, and actually, she has I think it's called regional complex pain disorder. It's a very frustrating pain condition, and she experienced pain in one joint for many months, and then it switched over to the other month, and medications didn't seem to work. And what impressed me is that her HMO, a health maintenance organization, she talked to her doctor, and that doctor recommended low dose naltrexone, and she felt some benefit from it. So one of the things I want to tell you about low dose naltrexone is that it is taken at bedtime. Typically, the dose for drug dependency is like 50 milligrams a day. Low dose naltrexone, you're typically taking 1, 2, 3, 4, or 5 milligrams a day or at night. And it seems to be more, in my opinion, of an adjunct treatment. So that one woman I was telling you about, she just found that it wasn't the end all and be all, but it helped seem to damp down the pain after a few months. So the other thing I want to tell you is that this is not something you use like ibuprofen. This is something you take every day, and after a few months that you notice less infections, less chronic pain, and that sort of thing, maybe less autoimmune disease activity. So before we introduce you to Dr. Peter Koshland, who's a pharmacist, I want to review some of the benefits of low dose naltrexone. So, number one, it reduces the production of pro inflammatory cytokines. And so this explains why it may be useful in reducing infections, chronic infections, where inflammatory cytokines are inflamed, and also explains why it may help with pain. It also suppresses cascade inflammation. So, one of the frustrating things about certain pain conditions is once the pain starts ramping up, it's very hard to reduce it. And many people experience that in headaches. If they get a migraine coming on, they have to get the medicine or the alternative medicine in very soon, or the trajectory of the pain is too much. So what's really neat about low dose naltrexone is that it reduces the painful inflammation cascade. So it stops this ramping up activity. And bottom line is it acts on the central nervous system. Now, other effects of low dose naltrexone is that it seems to reduce cell proliferation, and this explains why it may have some anti-cancer activity. It also upregulates opiate receptors, so it helps the body function without the opiates, and that's why it's useful in the treatment of drug addiction. And then another finding about low dose naltrexone is that it increases the natural production of anti-inflammatory endorphins. Recently, I talked with Peter Koshland, an integrative pharmacist, about low dose naltrexone, and this is what he had to say.
There's a lot of misunderstanding about what low dose naltrexone is, and if you haven't heard of it, and you're familiar with the drug naltrexone, you would think of it as an opiate antagonist or a drug that blocks opiate receptors, or as an anti-opiate that's used in things like alcohol withdrawal and other types of conditions. But what's really fascinating about this drug is that at very low doses, and we're talking about the dose that's used for alcohol dependence is 50 milligrams. We're talking about doses between 1 and 5 milligrams. It's a completely different drug. And it's really interesting because it also goes to show even drugs that we think we understand have myriad of different properties. And we're seeing that with some other therapies that we do that we could talk about. But at these low doses, it's actually stimulating endorphin release in the body. And it's also acting on certain aspects of the immune system to actually reset autoimmune processes. So it's totally fascinating. And it's almost, even though the chemical structure of the drug is the same, its activity in the body is completely different. And it's an extremely important tool for a lot of autoimmune diseases. I think it's been studied in over 100 conditions. There's probably 600 studies with this drug in the literature. It's very broad. So sometimes the challenge is, figuring out, is this the appropriate therapy for this particular patient? But when we think about, we know there's an autoimmune or an immune overstimulation type of process going on with the patient, low dose naltrexone comes straight to mind, because when it works exceedingly well. And we're developing tools to have higher and higher response rates with this therapy. So we're feeling like.
This concludes today's podcast on low dose naltrexone for pain, chronic infections, and autoimmune disease. If you enjoyed this video, please be sure to like and subscribe to our channel for more videos like this, and be sure to hit the alert button to be notified of new videos each week.